And I had probably dragged my right leg around for a couple years with some pretty significant pain. And if, as a nurse, I had probably walked a million miles in this hospital. And if there's one thing I can say is that I wish I had not been so afraid. I didn't realize that what I had dealt with for 2 years going into the surgery was 10 or 20, 30 times worse than what I was going to deal with for the few weeks after the surgery. I want to brag on the Joint Academy. When they first sign you up for that, I'll be honest, I felt a little silly. I thought, well, I'm a nurse, I know what to expect, and I don't think I really need to go to a class. I mean, really? But I will tell you, I may not have needed the class from the perspective of being a nurse, but my family needed that class, and they needed to know how to help me and to work with me and how to encourage me. So the class was very, very helpful to them, and truly, I'll be honest, I did learn some things. I'm not a surgical nurse, I'm an intensive care nurse. So I did learn some important things. So thank you for that opportunity, and thank you for that class. And then secondly, after surgery, I was on the Unit 1 West. Most of you all that had surgery were probably on that same unit. And those nurses there just did a phenomenal job. They just have this down to a very clean science. And, they had me up that evening after my surgery, and I was so excited to stand up and not have pain. And other than some incisional pain, which is to be expected, there was no joint pain. And I just can't tell you, after nearly 3 years of pretty significant pain, that was just such a blessing. I went through my course in the hospital and was discharged a couple days later, and then did physical therapy at home and was discharged from them in a couple weeks, and all of that went well. I didn't even know that they could do physical therapy at my house. So that was really, really cool. They came out to my house, and I didn't have to get in a car and get somebody to take me in the car. And in 2 weeks, they were able to discharge me. They said, you're independent. We don't need to be coming out here anymore. So all that being said, I was back to work in about 5.5 weeks. And I just thank the Lord for this new hip. I will never be afraid again if I have to have something replaced. I'm not saying it was all peachy keen, and there was some pain involved, but the pain was it was transitional, and it wasn't something that was going to last. And in the end, once I healed, it was so wonderful to ride my bike with my family or go on a walk with my husband and not be dragging that leg around like a limp noodle everywhere I went. So I'm thankful for this technology. One of the other things, and I'll just mention this and then I'll hush, I could ramble on forever, but I'm 52 years old, and one of my drawbacks about having replacement surgery is I had in my head that joint would only last 10 years, and I didn't want to have another surgery when I was 62. But you know what? Now I won't be afraid. If this joint doesn't last after 10 years, I will not be afraid to have that second surgery. I'll just say, okay, let's schedule it and let's do it. And that's such a blessing, because that really helped me back. I kept thinking, if I can just make it till 60, if I can keep walking on this leg till 60, well, you know what? Why be in pain for all those years? Just get a new joint if it wears out. So my take-home message, excuse me, is don't be afraid. Go early. Don't be miserable like I did for 2 solid years. And then work hard after your surgery. Do your physical therapy, do your exercises, because that's so important to your recovery, even when it's painful. And if you do those things, you'll have a good outcome. And thank you, everybody, in this program. I really do appreciate it. It makes me very, very proud.